Good morning. I'm excited to be here today with Governor Shapiro and Insurance Commissioner Humphreys for an important announcement from the Shapiro administration on removing barriers to care and extending access to services for Pennsylvanians with autism. My name is Michael Alos, and I received my autism diagnosis as an adult 3 days after my 50th birthday. Autism spectrum disorder is a developmental disability caused by differences in the brain. Each person experiences a wide range of behaviors and difficulties around social communication and interaction. The term spectrum is used because each person diagnosed as autistic can display a wide range of traits and levels of disability and functioning within that spectrum. Autistic children and adults may also have other conditions such as anxiety, depression, and ADHD. As a child, I had all the typical autistic traits, such as difficulty with friendships, communicating with others, and understanding the social norms in school. I also fell behind and struggled academically. As I grew into an adult, those same relationship and communication difficulties followed me. The impact of falling behind in school started to plague me as I moved to college. The communication difficulties affected my marriage. While I'm happy with who I am and the life I have today, I experienced unnecessary struggles and hardships that I might not have experienced it if I had been diagnosed in childhood and if the treatment options were different in Pennsylvania. An assessment and proper diagnosis are just the start of a person's life on the spectrum. There's ongoing therapeutic care that one might require to reduce the symptoms that interfere with daily functioning and quality of life. The earlier that autism is detected and the more treatments that are available, the better the autistic person can benefit from therapies, support, and school accommodations. Assessments and ongoing therapies come at a cost. The Shapiro administration knows that Pennsylvanians with autism need and deserve better care and support to live healthier lives. And today's actions will make a difference. And what Governor Shapiro and Commissioner Humphreys and the partners here today are showing is that when we work together, we can help autistic people live the best version of their lives. I want to thank Governor Shapiro and his administration for the continued work to ensure that health insurers provide autism services to every autistic person in Pennsylvania. Thank you. Now, I'll introduce Governor Shapiro.
Thank you.
Thank you.
Michael, thank you so much. Thank you for not only being with us today, but thank you for sharing your story. And thank you for your willingness to speak out and be an inspiration for others. We appreciate you, and I'm grateful for the chance to get to know you a bit here today. Thank you, Michael. And I'm proud, very much so, to be back here at Drexel University today with President Fry, who you'll hear from momentarily, and leaders of the A.J. Drexel Autism Institute and the ASSERT Collaborative. I wanted to specifically come here today for this announcement because Drexel plays a leading role in serving Pennsylvanians with autism, and I wanted folks to know about that. The A.J. Drexel Autism Institute was founded about a decade ago and is the first research institution in the country to look at autism through a public health lens. And today, Drexel University is at the center of the Commonwealth's work to support the autism community through the ASSERT Collaborative, a partnership funded by the State Department of Human Services that connects families and individuals with autism resources in their communities. And I want to thank dedicated partners who we have here today. You're going to hear a lot about partnership and the strength of our broader community. We've got several dedicated partners like the Eagles Autism Foundation. You'll hear from Ryan later, and who have taken your mobile service directly to the people who need it most with the Mobile Reach Unit, one of the first mobile centers of autism services in the country, traveling throughout Philadelphia and the Delaware Valley. I also want to recognize a friend and a close partner who is with us here today, Denny O'Brien. When I began my career in public service, I had the privilege of serving in the State House of Representatives along with Denny, who at the time was Speaker of the Pennsylvania House. In his first budget as Speaker, one of Denny's top priorities, if not the single most important issue to him, was increasing funding for autism services across Pennsylvania. He recognized that growing need in our communities many years ago, and together we worked to secure $10 million of new funding for adults with autism. And we also passed landmark legislation, at the time known as Act 62, that mandates insurance coverage for autism services. Denny, I want you to know that the way in which you pushed for the change years ago continues to inspire me and obviously continues to inspire others. Your advocacy has been a driving force, helping my administration do more and better serve the autism community here in Pennsylvania. I'm also incredibly grateful to work with leaders who currently sit in that same chamber. Leaders like Representative Jessica Benham, who joins us from across the other side of the state. She didn't wear black and gold today, Ryan, but I know she's a proud Steelers fan. Along with Jamie Flick, two public servants here today, along with several of their colleagues, Senator Tony Williams, whose district we are in today, Representative Rick Krajewski, Representative Tariq Khan. We are very thankful that they are here along with Representative Joe Hohenstein. We're grateful that they are here, this bipartisan group of lawmakers dedicated and committed to helping people with autism across Pennsylvania. You'll hear from Representatives Benham and Flick in a bit. While folks here may be from different parties, folks here also have real-life experiences that transcend party differences and inspires all of us into action. Today is the next step in our work together, and I look forward to making even more progress with these leaders in the General Assembly and others to advance this important cause. I want you to know I care deeply about this work, and I firmly believe that mental health is just as important as physical health. When parents go to schedule an appointment for their kids, they should know that their health insurance will cover mental health services fairly. I know this as a governor, and I know this as a father of 4 children. That's why, when I took office earlier this year, I immediately directed our Insurance Department Commissioner Mike Humphreys and the Pennsylvania Insurance Department to make mental health parity a true reality here in the Commonwealth of Pennsylvania, to hold insurers accountable so that mental health benefits are covered fairly. We already had mental health parity laws in place, but for too long, let's be real, they have not been enforced. So under Commissioner Humphreys' leadership, the Pennsylvania Insurance Department team worked to strengthen our mental health parity. How'd they do it? They reviewed about 400 insurance plans that operate here in the Commonwealth of Pennsylvania. And through that, we have helped more than 60,000 Pennsylvanians get back $6.25 million from insurance companies that violated our parity laws. Insurers who do business in the Commonwealth of Pennsylvania next year must follow our regulations for mental health parity requirements, and their plans now must pass an enhanced compliance review led by Commissioner Humphreys. This is real progress when it comes to our mental health parity laws and enforcing them here in the Commonwealth. I think this work is especially important for Pennsylvanians with autism, who frequently encounter barriers to treatment because of outdated or conflicting insurance policies. Let me explain that in a bit more granular level. For some time now, autism has been widely recognized as a mental health condition by researchers and doctors. So you would think that autism would then be classified that way by every insurer in the Commonwealth and therefore protected under our mental health parity laws. But unfortunately, this definition hasn't been consistently applied across insurance companies, and our federal government has frankly failed to establish nationwide standards, resulting in families here in Pennsylvania oftentimes being shut out of coverage or unable to afford vital services that their loved ones need. Today, I'm here at Drexel to announce that the insurance department has filed a notice in the Pennsylvania Bulletin directing Pennsylvania insurers to treat autism as a mental health condition to which the principles of parity now apply. My administration is making clear that autism services are mental health services, and under our mental health parity laws, we expect commercial insurers operating here in Pennsylvania to cover this type of treatment consistently and fairly every single time. Experts, well, they already agree. Autism is a mental health condition, and mental health services are the most effective treatments for our loved ones with autism. This action that I have directed removes unnecessary barriers, presenting some of the over 55,000 Pennsylvanians living with autism from accessing the care that they need. At my further direction, the Pennsylvania Insurance Department began notifying insurers this week who do business in Pennsylvania that we will require health policies for autism services to handle claims as a mental health service and ensure all autism services are covered fairly under our mental health parity laws. We have already put this in motion. You heard from Michael a moment ago, but let me tell you a little bit more about what this action means for everyday Pennsylvanians, what it means for real folks all across our Commonwealth. In 2018, a CERT here in Drexel conducted a Pennsylvania Autism Needs Assessment where they surveyed 8,000 autistic individuals and their caregivers about their needs and their experiences. That survey found that the top 3 services folks with autism needed were social skills training, behavioral support, and mental health counseling. 3 services that are related to an individual's mental health. But before today, for insurers who only covered those services for autistic individuals as physical health services, if that person needed one of those 3 key services, they could have been charged higher copays or deductibles, or they could have been rejected from coverage altogether. No longer will that be the case in the Commonwealth of Pennsylvania. I've talked to so many parents across this Commonwealth who are desperate to get their kids the help that they need. And let me tell you something. These moms and dads and these caregivers, they're doing everything, they're doing everything right. You know, they've done the research. They found the right program for their kid, the right service that will help their child or their loved one live a fuller, more productive life. But then they've been told time and time again that their insurance doesn't cover the cost of that particular care that they believe is necessary for their child. That's devastating to moms and dads and parents all across Pennsylvania, and we will not accept that anymore here in our Commonwealth. By defining autism services as mental health services, we are now establishing uniform guidelines. No matter if you live out in Pittsburgh or you live here in Philadelphia, all insurers who do business in the Commonwealth will have to make sure that these vital mental health services are covered no matter who your provider is. So that mom who's looking to cover early intervention treatment, those costs for her child, she can now find comfort in knowing that her insurance will cover that treatment for her child. And by working to ensure that commercial insurers can no longer apply arbitrary parameters like age limits for autism services as an example, we are making sure that as that child grows up, they're going to have a lifetime of services available to them that are so absolutely critical. Our administration is deeply committed to improving access to care for all Pennsylvanians. Here in an urban setting like this and stretching all the way out to our rural communities, I want to do everything in my power as governor to give folks the peace of mind so that they can live healthy, fulfilling, and successful lives here in Pennsylvania. So to everyone in the autism community, if you are getting denials for autism services or you're experiencing higher copays than you normally do, you need to know we got your back. And there are 2 ways I want to hear from you if that ever happens to you again. First, we've set up a special hotline for you. You can call us at 877-881-6388 and report that to us, or you can simply go online to pa.gov/autism to send us a report, and we will get on that right away. We have your back, and I want you to know we are going to continue to make the services you need affordable and accessible. It's really my pleasure now to bring up a woman who has been the conscience of a lot of our work in the General Assembly, Representative Jessica Benham from the western part of our state. She is someone with a powerful life story and someone who I look to for leadership on these issues. And as she comes up to the microphone, let me also recognize Representative Morgan Cephas, who has joined us here today, who does tremendous work on a whole host of healthcare issues, particularly related to women's health. So Representative Cephas, thank you for joining us as well. Representative Benham, the floor is yours. Thank you.
As an autistic woman, serving in elected office is certainly not easy. There seem to be more unwritten social rules and norms in this field than many, many others. But it is my absolute honor to not only be the first openly autistic state legislator in Pennsylvania, but also to represent my community back home, the gorgeous 36th district in Allegheny County. And I know that so many other autistic people and LGBTQ+ people and young people, working class kids and women see themselves reflected in the work that I do. But growing up, I rarely, if ever, saw myself reflected in leaders. And if you had asked a younger version of me that she would ever be introduced to speak by the governor of Pennsylvania, she would have laughed at you. I hope that many autistic young people look at me and know that they can serve and lead in their communities. And I know that the stigma, bigotry, and ableism that I face today will be lessened for those who come next. While it is not easy in this world that was not built for people like me, nothing worth doing is ever easy. And my life's motto at this point might as well be, I knew it was difficult, but I did it anyway. And I know that that is a perspective our governor and his administration share. Autistic people and disabled people broadly belong in the halls of power and at the tables where decisions are made about our lives. And I relish the opportunity to uplift the voices of other disabled people and to ensure that our perspectives are heard. Today, we're here to celebrate a significant positive change to health insurance coverage for autistic people. As an adult, when I went to the doctor, my doctor previously could not bill my insurance under an autism diagnosis for the services that I was receiving, because autism, according to my insurance plan, was only covered for those under the age of 21. Now, since I have co-occurring diagnoses, I could still get services, but others have struggled to receive that same care. Parity for coverage for autism-related services and other services has long been a goal of the disability community, and I am grateful to Governor Shapiro and his administration for prioritizing this change. I know that autistic individuals of all ages will benefit from greater access to care. And while there is still more to do to ensure access to care for individuals with developmental disabilities, this is a step in the right direction. And while autism doesn't quite perfectly fit into that mental health category, we live in a world where we only know what autism looks like when it is paired with trauma, anxiety, depression, and the like. We don't know what autism looks like without those mental health impacts. In this world that was not built for us, autistic people experience more discrimination and stigma, fewer educational and employment opportunities, and an increased risk of sexual harassment, assault, and other violent crimes compared to our non-autistic peers. Greater access to healthcare is that first step in creating a world where no one experiences those impacts. And accountability of our government demonstrating this leadership here is key. Each of us have a role to play in pushing our world toward justice. The more privileged among us have an opportunity and an obligation to leverage our privilege to uplift others, recognizing that the only way forward is together, and the only way we get justice for any of us is if we get it for the most marginalized among us first. So thank you, Governor Shapiro, for your leadership. We know that it's difficult, and you do it anyway. And with that, I would like to introduce my colleague, with whom I have a wonderful working relationship on many of these issues and others, Representative Jamie Flick.
Thank you very much, Representative, and thank you, Governor, and thank you, President, for the invite today. I am from Lycoming and Union counties, and if you draw a straight line, we're about the same distance from Philadelphia as we are from Pittsburgh. So I'm going to stay between both of you today. I think is a good idea.
Eagles fan, right?
We'll see.
He's a Little League
We're
World
holding
Series.
out on that. I got to get a bridge, and then we'll decide. So again, I'm from the 83rd District. My background, I'm a freshman. My background for the last 30-some years has been developing software, a bit of a different background. Jessica and I are sort of opposite in parties, opposite in gender, opposite that she's urban and I'm rural, but what connects us is mental health and today, certainly autism. But my background with the software company has been developing for roughly 60 of the 67 counties, mental health software, drug and alcohol software, intellectual disability. So before taking office, I've worked with DDAP, I've worked with OMSOS, I've worked with Octal. So that sort of led me from a technical side to run for office, a little different than most people run for office. No political science background, no political background whatsoever. So I noticed some technical changes that were needed. I noticed some reporting changes up the ladder to the state that were needed, and that's a big part of the reason I ran. So I also have a child that was diagnosed autistic. So that is a small part, but I'm here not just for my child, but for all Pennsylvanians, everybody in the 83rd District and beyond. I'm not a speaker, so with that, I can't thank Drexel University enough, and I'll turn it over to President Fry. Thank you very much.
Thanks, Rep. Thank you.
I actually think he's a great speaker. So first, I want to say that I was listening to Governor Shapiro's remarks and sort of thinking of my sister, Lori, her husband, Tim, and their son, Jack, who's 23 and is on the spectrum. And Governor, when you were talking about the moms and the dads and the constant pressure and frustration to get support that they, deserve, it just rang so clearly. So I just want to hold this up as a moment of real leadership by our governor, not just smart leadership and smart legislation, but also incredible compassion and humanity, because those words really rang through. So thank you for that. I appreciate it. So it's, as always, a great honor to welcome Governor Shapiro back to Drexel, which stands shoulder to shoulder with his administration in support of health equity and mental health parity. A little more than a decade ago, our university established the A.J. Drexel Autism Institute as the nation's first center to focus on public health research in autism. Our goal then was to deliver tangible benefits for people with autism and their families, first through innovative multidisciplinary research, also through community-based initiatives and collaborations with universities and hospitals and autism service providers to increase access to critical resources and quality services, and finally, through advocacy for more effective government policies. Thanks to the work of our incredibly gifted team at the A.J. Drexel Autism Institute and our many, many partners, we've come a long way over the last decade. The Institute created Mobile Reach, one of the first mobile units of its kind to provide, as the acronym suggests, resources and education for autism and community health. We forged public-private partnerships to help educate the public about the extraordinary skills that persons with autism have, while also creating more effective pathways to college and employment for hundreds of neurodivergent people. As proud members of the ASSERT Collaborative, we have been heavily involved in major projects, including the statewide resource center, professional training, and justice system-related initiatives to help individuals, families, and practitioners navigate the unnecessarily complex healthcare, insurance, and eligibility landscape. And the A.J. Drexel Autism Institute has received 3 Autism Centers of Excellence awards from the National Institutes of Health. Most recently, a $10 million grant to support its research to understand and reduce barriers to good health and healthcare access for autistic people. Governor Shapiro, the steps you are taking today to ensure that health insurance companies fully comply with the Mental Health Parity Act is a giant step towards eliminating those barriers once and for all. Here to explain what this means to our citizens of the Commonwealth of Pennsylvania is the director of the A.J. Drexel Autism Institute, my colleague, Dr. Diana Robbins. Thank you.
Thank you, President Fry, for being a champion for the Autism Institute. I also would like to thank Governor Shapiro and his administration the Department of Human Services, and the Insurance Department for their continued support and action for Pennsylvanians with autism and intellectual and developmental disabilities. At the A.J. Drexel Autism Institute, the first organization to apply a public health approach to autism science, we pioneer research to better understand autism and drive impactful change in our communities and worldwide. We focus on population-level questions to benefit the broadest range of individuals, and we actively involve the autistic community, their families, clinicians, educators, and policymakers in our research. This ensures that our findings make a difference in the community today, reducing the often seen delays translating research findings to real-world impact. Today, I am proud to acknowledge the work of the Autism Services Education, Resources, and Training Collaborative, known as ASSERT, especially the Eastern Region team based here at Drexel's Autism Institute. ASSERT, funded by the Commonwealth's Bureau of Supports for Autism and Special Populations within the Office of Developmental Programs, brings together universities and state government to create practical research projects and community-focused efforts to support the autistic community. Today, we are all here together to celebrate a significant milestone in Pennsylvania mental health parity for autistic individuals. Mental health parity means that insurance plans should provide fair coverage and financial support for mental health and substance use disorder services, including autism services. This new policy acknowledges that insurance plans often limit mental health benefits, which goes against the Mental Health Parity Act. Access to services is essential to support the health and well-being of people on the autism spectrum. The new policy will increase access to mental health care across the life course. It builds on the progress of Act 62 and sets the stage for better long-term support for autistic individuals in Pennsylvania. Next, I would like to introduce Ryan Hammond, the Executive Director of the Eagles Autism Foundation.
Thanks, Doctor. Thank you. Thanks, Ryan.
Thank you. Okay. Excuse me. All right. Thank you, Dr. Robbins and our friends at Drexel, especially President Fry, for hosting us for such an important event. For those who don't know, the Eagles Autism Foundation was founded in 2018 by Chairman and CEO Jeffrey Lurie, inspired by his personal connection. Our goal was to raise millions of dollars for innovative research and programs while leveraging the brand of our Eagles organization to give a voice to the now 1 in 36 individuals affected. In just over 5 years, the foundation has raised over $25 million, with every single dollar we raised being invested through a scientific process that matches the care and rigor in which Howie Roseman is drafting players in our field. Yes, shout out to Howie. To ensure that every dollar is measurable, focused on outcomes, innovation, and most importantly, transformational in people's lives. Thanks to Eagles Everywhere, we've elevated the profile of our city when it comes to supporting the organization through funding, especially supporting local institutions. Today, we've expanded our efforts to create a global impact. Our grant process started here in Philadelphia with partners like Drexel, and I'm proud to say that in addition to the AJ Autism Institute here, that we extend to an international footprint. We are so proud to take part in today's press conference and support the work of Governor Shapiro and key stakeholders whose efforts will result in much-needed access to services for those individuals diagnosed with autism. We know intervention and support is critical in changing the life trajectory and outcomes of a person. And we believe through this policy, families' needs will be better served and lives will be changed as a result. We recognize it takes all of us to advance a collective mission of helping people live their best life. And today is a wonderful example of what we can contribute and continue to build upon in the future. Thank you again to Governor Shapiro for his leadership and for all of those advocates for the autism community. On behalf of the Eagles Autism Foundation, we are so incredibly grateful to celebrate such an important milestone in our community. I did have Go Birds, so I'd like to say Go Birds.
You're good. You're good.
And at this time, I'd like to turn it over to Commissioner Michael Humphreys.
Thanks, Ryan.
Sure.
Well, thank you, Ryan, and thank you all for being here and for sharing your stories. both professionally and personally. It's truly a powerful statement made today of just the broad impact of the action that the administration has taken. And thank you, Governor, for your leadership as we take this giant step forward towards making mental health parity a true reality for all Pennsylvanians. The Pennsylvania Insurance Department fully supports your goal. A number of my staff is here today. They have played a key role on the enforcement from a policy perspective and in examination and legal perspective on bringing mental health parity into the forefront. For the past 4 to 5 years, PID has been making rigorous efforts to inspect, examine, and investigate potential mental health parity violations. So today, we're making it clear that we expect insurers to fully comply with parity regulations in administering autism coverage and define autism services as mental health benefits. Categorizing autism as a mental health benefit will have many positive impacts for Pennsylvanians with autism, regardless of their age. Generally, this means that health insurers may not charge higher copays or deductibles for autism services than they do for physical health services. It means that health insurers may not cover fewer autism service visits than they would cover for visits for comparable physical health conditions. And it means that health insurance policies that cover individuals and that cover fully insured employers may not impose annual or lifetime dollar limits on autism care. We expect any insurer currently categorizing autism services as a physical health benefit to promptly adjust its claims handling processes by January 1st, 2024, to provide Pennsylvanians with autism the protections afforded by the mental health parity provisions. The Shapiro administration is bringing all these partners together and advocates to ensure more Pennsylvanians get care. And we want the autism community to know that PID is here to help. If you're receiving denials for autism services or hearing there are going to be limitations or unexpectedly high costs, please reach out to the insurance department. We want to hear about it, and we want to work with you to get needed care and the insurers to avoid or enforce mental health parity violations. To learn more or to connect with our Consumer Services Bureau, visit us at pa.com/autism. You can also connect with our consumer team by calling 877-881-6388. Thank you again, and I will now turn it back to the governor.
Thanks. Thanks, Mike. Thank you. Before we take any questions, which I'm happy to, I think everyone here is happy to, I just want to thank all of our speakers, all of our partners, thank President Fry again for welcoming me back to Drexel University. And it should be lost on no one that we've got some really powerful lawmakers who are here today. You heard from Representative Benham and Flick. We really appreciate their service, and we're really grateful, of course, to Representative Krajewski and Hohenstein and Kahn, Senator Williams, Representative Cephas. We're really thankful for their leadership and for their time today. And with that, I'm sure they'd be happy to take any of your questions as well. So go ahead. Okay.
Press?
That means we did a good job, gang. Thanks, everybody.